everyone, this is Ariel Richardson. Today I'm going to be talking to you guys about the Surgical Care Improvement Project. Before I explain what the project's core measures are, I would like to talk about the organizations involved. These organizations include the Agency for Healthcare Research and Quality, the American College of Surgeons, American Hospital Association, American Society of Anesthesiologists, the Association of Perioperative Registered Nurses, the Center for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, the Institute for Healthcare Improvement, the Joint Commission for Accreditation of Healthcare Organizations, and the Veterans Health Administration. All of these organizations recognize that there was room for improvement within prevention and cost in hospitals and implemented core measure sets to promote better overall outcomes. All of these core measures fall under the Surgical Care Improvement Project. I have listed key points to each core measure under this project. They include prophylactic antibiotic received 1 hour prior to surgical incision, prophylactic antibiotic selection for surgical patients, cardiac surgery patients with controlled 6 a.m. post-operative blood glucose, surgery patients with appropriate hair removal, urinary catheter removed, surgery patients on beta blocker therapy, surgery patients with recommended VTE prophylaxis ordered, surgery patients received appropriate VTE prophylaxis before and after surgery. Through implementing these core measures, the organizations were hopeful to prevent morbidity following surgery. Before this project was implemented, surgery sites infections accounted for 14 to 16% of all hospital-acquired infections. VTEs occurred after 25% of all major surgeries and 50% of all orthopedic operations. Cardiac events accounted for 60% of all post-operative mortalities in patients prescribed beta blockers. These core measures also aimed at reducing respiratory complications, controlling blood glucose, ensuring proper hair removal before surgery, and maintaining proper body temperature. The Surgical Care Improvement Project set performance measures to help achieve their goals. Some of these measures include prophylactic antibiotic received within 1 hour prior to surgical incision, prophylactic antibiotic selection for surgical patients, prophylactic antibiotics discontinued within 24 hours after surgery end time, cardiac surgery patients with controlled 6 a.m. post-operative blood glucose, surgery patients with appropriate hair removal, urinary catheter removed on post-operative day 1 or post-operative day 2 or within day of surgery being 0. Surgery patients with perioperative temperature management, surgery patient on beta blocker therapy prior to arrival who receive a beta blocker during preoperative period, surgery patients with recommended VTE prophylaxis ordered, surgery patients who received appropriate VTE prophylaxis within 24 hours prior to surgery to 24 hours after surgery. Performance outcomes would be measured within a timely manner. Some of these outcomes measured include post-operative surgical site infection rates diagnosed during index hospitalization, embolism diagnosed during hospitalization or within 30 days after surgery, DVT diagnosed within the index of hospitalization or within 30 days, acute MI diagnosed within hospitalization or within 30 days, postoperative ventilation association pneumonia diagnosed within the index of hospitalization. The Surgical Care Improvement Project was retired in 2015 and did meet its goal of reducing surgical complications by 25%. So let's see how the Surgical Care Improvement Project would work in a hospital setting. First, we're going to meet Dave. Dave is a 65-year-old male. He is diagnosed with hypertension and currently taking propanol for this hypertension. He's scheduled for surgery tomorrow at 9 a.m. for a left side total hip replacement. Dave's medical team includes his primary care provider, a surgeon, a team of nurses, physical therapists, occupational therapists, and care management specialists. Now, these care management specialists can include doctors that are neither his surgeon or his primary care provider. Before Dave's surgery, his care team is going to utilize the Surgical Care Improvement Project's algorithm to guide them through picking the best medications and care plan for his scheduled surgery. The one I have listed is preventative measures for VTEs, but the Surgical Care Improvement Project has several different tools for prophylaxis of infection, and other things. So the day of surgery, Dave's going to come in and be assessed before his surgery. The nurse is going to check Dave's identifiers. She's going to match his name with his armband, his birthday with his armband, and make sure Dave doesn't have any allergies. She's going to go over Dave's rights, right patient, right medication, right time, right dose, and right site. And based off of the SCIP guidelines, Dave's going to get his propanol, that's the beta blocker he's taking for hypertension, to avoid any cardiac event. He's also going to receive cefazolin as an approved prophylactic antibiotic. This antibiotic will be discontinued within 24 hours after his surgery end time, per SCIP standards. In addition to that antibiotic, Dave will receive low molecular weight heparin. This is another approved medication. He's going to be given this for VTE prophylaxis. We're also going to ensure that Dave has all appropriate hair removed before his surgery. So because we have followed the SCIP guidelines for surgical care improvement, Dave's surgery was successful with no adverse complications. Here are my references. Thank you guys for listening and hope everyone has a wonderful day.